Bright Idea Records. I hope you're having a nice evening. I had to go to a doctor's appointment today, and it went well. I mean, you know, I've been having this wasn't a pain doctor. No, I have no plans on doing that because it's a complicated situation. I'm hoping that I have an idea that might help to do all the things in the title of this stream. I believe the title of the stream was A Plan to Save Lives and Ease Consciences, conscience of the voters and constituents of the nation. The lives hopefully saved would be the lives of patients that require pain medication, and also it would serve the patients because I am one. I am a pain patient and I can't get pain meds. It's been very difficult. Um, Doctors are very reluctant to prescribe pain medication because there's a epidemic, because there were 14,000 lives that were lost in the year 2020 to mostly illegal narcotics, otherwise known as street drugs. Not so much medication, but because the medication that is available is the exact same thing for the most part, it is an opioid. So it gets lumped in as part of the problem. And in 2021, the death rate went up to 16,000 people in the United States of America. And hence the epidemic status that we are currently experiencing. I have found this to be quite frustrating. For the past going on 13 months now, I have been unable to maintain my regimen that was established many, many, many years ago. I was, in a pretty bad accident about 20 years ago and finally started to take opioid medication 15 years ago. So it was not my first choice, but it did provide me with stability and control over things like my schedule, things like, functioning, doing the tasks. A lot of them would be considered daily tasks that are required for a person to live a normal, dignified, somewhat respectable kind of life. So, it's been pretty rough. The past 15 years and the past 13 months have been pretty rough. I would say, though, that the past 13 months have been, nearly impossible for me. And so I understand the nature of this problem. I believe, at least with regards to patients, to medical patients, chronic pain patients, and I can't really comment on the nationwide epidemic with regards to the illicit users. Um, Obviously, that is a much more complicated problem because it is, it's, it's already illegal, so it's obviously an unregulated thing, the usage of the opioids on the streets or what have you. But with regards to pain patients, it there most certainly can be and should be a type of control mechanism, and I believe it should be implemented on a state level. We do have a thing called the HIPAA Act, which has to do with patient privacy. It is a federal act, and it pertains to keeping patient records private because, especially in this new modern day and age, people have come to not only appreciate and respect their own privacy and the privacy of others, but they are taking it so serious that they are actually doing things to maintain their privacy. And as such, yes, this would not be a federally implemented plan, my little idea. I am not a lawyer. I am not a politician. I am a musician and I am a chronic pain patient, and I am also a public access television producer, producing television at Access Tucson, and previously known as Tucson Community Cable Corporation. It was basically the same place. It's just they rebranded it because it really wasn't a corporation. I mean, yes, they had TV studios and cameras and lights and control rooms and even a staff of facilitators, but really what was at the core of the TV studio were constituents, users of democracy. A large majority of the programming that was available on public access cable television in Tucson, Arizona, and also across the U.S., the United States of America, public access television has often been used as a political tool to help constituents stand up on top of a virtual soapbox, if you will. The term soapbox was invented because, I guess a long time ago, there was a person that needed to get their point across with regards to political matters, which relate to people and laws and the lives that they get to live and the quality of those lives. And apparently this person stood on top of a soapbox so that way they could be heard. Their voice would carry farther and they could be seen. If people form a line, if you will, or crowd. Yes, it helps if the person speaking is elevated. I digress. I got to witness many people do this type of a thing and even take phone calls, which I will not be doing. I am merely trying to make a record of my idea because after today I will probably forget it. Like I was mentioning, I had a doctor's appointment earlier and I was talking with my healthcare provider about my struggles over the past 13 months to function and maintain my life. Of course, this is a part of my regular checkup. When I go to see my healthcare providers, they tend to ask me if I'm on any new medication, if I have stopped taking any particular medication, if anything has changed, and how have I been doing, that kind of stuff. And I'm sure you're familiar with what I speak of. Today, my blood pressure was higher than I've ever seen it in my entire life. So I've been very stressed out by my chronic pain caused by my injury 2 decades ago. And if I do not figure out something to do to help myself, I could have a big problem besides the pain. I'm quite agitated, quite irritable, and in a lot of pain. And yeah, it's giving me very, very, very high blood pressure. I took a pill, so I'm trying to not have the high blood pressure. So here's my plan, okay? If you're ready, I'm ready. Like I say, I was thinking about this problem earlier because somebody has to. I recently contacted a doctor named Doc Talks. He has a channel on YouTube. I reached out over Facebook, and that's just another indicator that I've got to do something, and I'm reaching out because, yes, something has to be done. So, what is the problem that I speak of? The problem that I speak of is the unavailability of pain control medication to the very people that need it most, chronic pain patients. These people like me, normally go to what are referred to as chronic pain clinics, and at these chronic pain clinics, you get to get your medication, but actually you get your medication from the pharmacy. You get your prescriptions from the chronic pain clinics. And, there's a lot of rigmarole involved with getting a prescription for the medication. Also, there is a lot of rigmarole involved in the adjustment of the doses in an effort to get you on the perfect level of medication, because not everyone has the same level of pain, chronic pain, which means every day. There are two types of pain, apparently, as far as the medical profession is concerned. And chronic pain is the kind of pain that does not go away, as opposed to acute pain, which is considered to be something along the lines of temporary pain, like the one that a person might experience after a surgical procedure and or an injury. And so it is expected that after approximately 6 weeks after a surgical procedure, most patients are expected to not require any pain medication whatsoever, especially of an opioid-based nature. So, naturally, anything that extends out beyond 6 weeks would definitely fall under the category of chronic pain. And, I guess at the pain clinic, you also get your urinalysis. They do that to make sure that you are taking the medication and that you have the right levels in your system, the appropriate levels, which can be determined, very scientifically. There is the possibility of test failure, or perhaps getting a faulty test, or just an anomaly with regards to the scientific process of testing for substances and chemicals and stuff. Like I say, I am not a doctor nor a lab technician, but I do know that sometimes they fail, and it is up to the doctor's discretion how to handle these situations, because the patient has to sign what is referred to as a pain clinic contract, and the pain clinic contract is let's just say it's oppressive. There's a lot of things in there that most people would never agree to, but when a person is suffering, it's amazing what they'll agree to. They'll just give away just about every human right they have in an effort to just get some help, because it's very difficult. It's next to impossible to function when you got a chronic pain condition. And it is best if you can keep it a secret, because most people, it would seem to me, are quite ignorant of chronic pain and what it actually is, and the usage of pain medication with regards to chronic pain patients, because, it's kind of like the epidemic we're experiencing now, where it's all people kind of don't know what to think, so they just think of it as a bunch of people taking drugs. They don't really distinguish between patients and drug users or abusers, as the case may be, which is a shame, and why I would recommend, you know, never telling anyone that you're a pain patient if you can avoid it. I have been quite public recently about all my struggles because, quite frankly, I don't know what to do. It is a very complicated issue, especially for a person in my shoes. My injury did not just leave my body mangled, but it also left me with post-traumatic stress, survivor guilt, and just a certain amount of mis. I really just kind of have trust issues now, but it's okay. They don't inhibit me too badly. I never was that outgoing, but the thing is this is pretty outgoing for me, talking about a problem like this in a democratic way. The only way I can really do this is to attempt to recall the television studio where I made video games and more, and all of the political programming that I volunteered and worked on, doing things like camera work, audio board mixer manipulation, and Grass Valley switcher directing. Um, but here's what I imagine. If you're, you know, unable to get your medication because the doctors and healthcare providers are afraid to prescribe because of the fear of having their license taken away, which is a state issued license that is approved by the state board of medical professionals, something like that. You know, it's a board of directors, and they are medical experts. I believe they are all practicing doctors. I don't know if they have to be, but so that is the what the healthcare practitioner fears the most on the state level, having their license taken away. But on an even more heavy duty level, serious level, is the federal level, which is where it starts to involve things like the DEA, the Drug Enforcement Administration, and there can be actual, you know, legal ramifications of a criminal nature if it is found or determined or even suspected that a healthcare provider is being reckless with their prescriptions and being reckless with their patients. So there's a lot to fear, is there not? For a doctor that just wants to earn a living, it seems like a lot of stress that a person might have to live with. And it is not very fair to the doctor. But as a result, as a side effect, you could say, this manifests over into the patient's life in the form of not being able to get medication. It was always difficult for me because I got injured at the age of 23 years of age. This accident was pretty bad and I was pretty young. So naturally, for whatever reason, doctors scrutinized my need for the medication seemingly more so than they did other patients. Apparently, young people are expected to be drug abusers, at least mathematically more likely, statistically. So that was never very nice. That was never very fair. But I was always able to usually get my medication with little problem, even though I was considered a risk just by being young. It's discrimination, plain and simple. And usually I found that after a very short period of time, like about less than 2 years from joining a clinic, I would get dismissed and they would send me a letter letting me know that I need not come back to their clinic. And I really didn't put two and two together and figure out that the 2 and 2 is 4. I really did not figure out why this kept happening to me until I'd basically been kicked out of every clinic in town, which is a very difficult predicament for a patient that requires pain medication. This last clinic that I got kicked out of, about 16 months ago, this last clinic, they didn't even keep me around for a year. I was only there for a few months before I got my discharge letter, my dismissal. And I had to drive really, 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 really far just to get to this place, because it was like my only option. So it was pretty ridiculous. And I was so fed up with the way I'd been treated and everything that I've said, to heck with this, I give up. And it's been a regrettable but necessary decision, if you can believe that. Yeah, I have my dignity, and I am not a slave to my pain. I am not a slave to my injury. I am not a slave to a drug, and I most certainly will not be disrespected by these medical healthcare professionals that supposedly agreed to an oath called a Hippocratic oath. They swore to help their patients and do no harm. Yeah, well, the way they treat me harms me. It makes me resentful. Do you hear me? I'm really just pretty mad about it. So, and I've got a blood pressure problem. That's great. Let me continue. Maybe now you're starting to get a better idea of the problem at hand. It is a problem of no gray zone. There's no middle zone for a pain patient to exist in. You're basically a patient like any other patient. It's a pretty broad category, Usually patients receive things such as medication. Sometimes they receive things like procedures, whether it be physical therapy procedures, etc., or even as serious as a surgical procedure, which usually requires going inside of the patient, whether with arthroscopic tools or using traditional implements such as scalpels and sutures and such. But essentially, that is the realm of the doctor, the healthcare provider's medication and procedures. And malpractice is always a possibility, but patients always have the right to weigh the benefits, the pros and the cons, and make an adult decision for themselves. Or if it is a juvenile that requires a medical procedure, they can always have their guardian make the decision to not go along or to go along. That is what it is to be a patient, and that's what it is to be a democratic constituent. You get to weigh the pros and cons of any offer that you have been given. That's what it is to be a free market capitalist. You get to weigh your options and make a decision about what to do. At this point in my medical career as a patient, I have no decisions left to make. It is quite ridiculous for me to be in this position, and it is quite obvious why we need some sort of a middle zone that would take some of the accountability and threat of malpractice, something to relieve that from the healthcare provider, so they do not have to live with quite so much worry and quite so much responsibility with regards to the patient and their eventual outcome, whether that outcome be grateful and very helped, or perhaps the morbidity of it all and winding up deceased, or maybe perhaps somewhere in the middle, maybe not deceased, but just dreadfully addicted to a substance that they did not know. They were not made aware of just how physically addictive a substance such as narcotic opioid pain medication can be. It is basically a requirement that the patient has a stable source for their medication. For a chronic pain patient to have to live with the possibility that the very thing that they require to live, that they need to avoid things such as withdrawal sickness, as it's called, when a opioid patient has to cessate from the medication and stop. There are many various side effects, and I believe that all of this information that I'm telling you is very technical, and you do not need to know it because you are not a pain patient. Obviously, if you are a pain patient, please excuse me. I am expecting to just be speaking with the constituents of the United States of America, for which most do not suffer from chronic pain conditions, whether it be from disease, injury, or otherwise. So, since this problem is a very specific one and only affects a specific type of person, a type of patient, I believe that if implemented on a state level, some type of educational program for the patient to go through with a final exam at the end for the patient to take and have graded, I believe that a medical patient could become a certified opioid expert, like a patient, It would be much like a state driver's license, and the way there is a test about things such as traffic lights, signs, and other varying legalities, as well as skill-based, and also I am a concealed carry gun owner. I have been since around 2007, which, interestingly enough, is around the same time period that I started requiring the chronic pain medication. Now, I have never had an accident with my medication. I have never had an accident with my firearm. And that is because I am educated. in order to get my concealed carry license, I had to sit through a weekend-long class taught by this nice dude named Ron over at the Marksman. That's like a shop where you buy guns and ammunition and firearms, you know. And the thing is in that class over the weekend, I learned many, 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 many things about being a proper, safe, and respectable firearm owner. And most importantly, I learned the laws and how to not break them. If I would have purchased a gun without having that class, I have a very strong feeling, I'm pretty sure that I would have made mistakes, possibly lethal ones, because of ignorance with regards to the laws and common safety practices for which all gun owners and users really should know, in my humble opinion. Unfortunately, I could not find any type of equivalent type of class on how to be an opioid patient. As a musician, I had experienced the societal effects and drawbacks of opioid substances, having witnessed some of the people in my musical community having witnessed overdoses, requiring things like submerging the person in a cold bathtub and putting ice cubes into the water in order to shock them back awake. Very terrifying things that most people only see in movies such as Pulp Fiction and Trainspotting, which, although those movies did spread information, awareness, and educate in a lot of ways many people, as far as I know, movies like that don't get made very often anymore. I think the most recent one I saw was called High Times, starring Timothy Oliphant and company. And I'm just sharing that because I believe in education and information, and I believe ignorance is the enemy. So naturally, if something similar to a driver's license test or a concealed carry weapon style of course, sharing information with the opioid patient, such as just how much morphine does it take to overdose? Do you know? I know. And I don't even have to look in a book. It's like 420 milligrams, I think. And that's a lot. Most morphine is prescribed in like, I think 15 milligram is the lowest dose. I think that the lowest that they manufacture. It might be 30. And I believe it goes up to 60, perhaps 90 milligrams. So basically, if you were getting a strong dose, like let's say 60 milligrams of morphine, that is a pretty typical dose for a time release patient, you know, that like will receive 12 hours worth of relief from most of their chronic pain. Although there are things called breakthrough medications, and I could not wrap my head around that at first because I had never had pain treatment and I did not know what to expect with my control medication, nor did I know what to expect with the breakthrough medication. But it's a pretty simple concept. It's kind of like you have the breakthrough medication for the breakthrough pain, which is the pain that you sometimes get even though you're on a control medication. Sometimes it's just not enough. So that is when you use the breakthrough medication. But anyways, if you were taking a 60 milligram dose of morphine, let's see, 120, 240, 300, that's, yeah, 5 pills, and you're already up to 300. So it's not easy to overdose, but if you forget that you took your medication, or if you're in a whole lot of pain and I guess the breakthrough medication isn't working and you're not paying attention to the clock, it could happen very easily if you think about it. All you have to do is take like 6 or 7 pills in a 12-hour time span. And yes, I know that that's a gargantuan amount of medication to take in that time span. But, I don't think patients really get educated enough about these things. Maybe you will get an explanation from your pharmacist about it. Maybe you will get an explanation from your doctor about it. But the fact of the matter is, there is no quiz that you have to take. There is no exam that you can fail. So therefore, even if you get an explanation, even if you get a pamphlet handed to you with your medication when you pick it up from the pharmacy, there is still a high likelihood that the patient may not know what they need to know to avoid accidentally overdosing and quite possibly accidentally killing themselves. It should seem fairly logical and fairly obvious that what I am describing is a much needed thing on a state level to save lives, and also would be a very inexpensive way to do so, costing only what an average weekend class costs, in terms of an instructor and testing materials, and a place, to gather. It is a relatively common thing, especially with the driver's licenses that I speak of. Of course, they have a motor vehicle division building where people go to take that. So these are the little details that would have to be worked out by your state elected officials and representatives, seen as how, it would have to vary from state to state depending on what's available to the constituents of that area. But if a program could be thought up by the board of medical directors and professionals for your state, figuring out exactly what kind of an exam and what kind of procedures it would take to educate patients as to the most important things like sharing your medication is a federal crime, punishable by federal laws. I'll bet a lot of patients don't know that. Also, it might not be a bad idea to teach patients about the morphine equivalency chart, where you learn things such as 2 milligrams of dilaudid is equivalent to 15 milligrams of morphine. which is equivalent to 30 milligrams of like oxycodone. Pretty sure I got that one right. But it's a very good idea to know those things, especially at the beginning of a patient's treatment, because oftentimes the patient will be shifted around from different medication to different medication in an effort to find what is most efficable, most effective with regards to relieving the patient's pain and helping them live a normal life, a productive life, a respectable life. All right, I think I did a pretty good job. I really didn't feel like streaming today, but I wanted to make sure that I got my ideas out. And I put the statues up on the display to let you know I was serious. That's Pancho Villa right next to me. And that's Father Kino. And that's the Statue of Liberty. I'm JJ. And I gotta go. My back hurts. I'll see you later. And I'll come up with a better version of this. These are my notes. So, alright. And I will try to make a letter to send to our elected representatives and officials, just like we did when we tried to save our public access TV studio. Come up with some kind of an email form. All right, take care and be careful.